sir?
Good.
Good.
I'm good.
Good.
How are you?
Yeah, good, good. Various people, cross-section of the people which I come across.
Okay. Yeah.
They have some issues which we feel and my friends feel, but they don't know. Can I talk on that?
Yeah, please. I think that is the right thing to discuss about, because there are lots of things people have a lot of doubts about whether to talk, and then after talking, what do we do,
Right.
where do we go? There are a lot of things. I think it's good that we decided to talk about it. Good.
I have a person, her name is Sujata. She has done her course in graduation in fashion technology. She is of 20 years old, pretty. Her parents, she won't listen to her parents and she won't open up herself to her parents. She is an introvert. So she always thinks that she is having some problems and she never reveals that to her friends or relatives or parents. She is nice and not outgoing. She is introvert. This has been complained by her parents as well as friends also. So she always thinks of the things which she is not completing properly.
What you're trying to tell me is that, like, you have somebody you know, otherwise fairly smart girl, doing fashion technology, but somewhere they find that, like, she's not very communicative.
She's not communicative.
Positive outlook is not there. Everything she doubts, and then she says, well, can I do this? Will I be able to do this? Will I be able to function like this?
Yes.
That's what I understood. Like,
Yes, absolutely.
yeah, I think what you told is maybe some very milder and then day-to-day common occurrence. But I think maybe at this point it may be better if we talk something about the depression.
Okay.
See, I don't say that this particular girl has got depression disorder as it is, but now, like, otherwise everything is good, but always she keeps thinking about something negative. There is no reason.
Yes.
Parents would have told you everything is alright, doctor, she studies well and she does well, she does all those things, but problem is, a lot of times we fail to identify depressive disorder in our population. I think I'll take this opportunity to go a little bit more on this, because generally when you talk about a psychiatric illness like depression, people get a little bit agitated and say that, oh my God, she has got psychiatric. No, I don't think you should worry about it. Depression is a very common, very common psychiatric disorder.
Okay.
The least percentage is 5%. One of the recent studies that the Bangalore Nimans has done.
Only 5%?
5%. Yeah, I'm putting it as the lower side. I don't want to exaggerate things and then put it on the higher side. The least is 5%. If we take that simple example, that 5%, in our twin cities of Hyderabad, Secunderabad, as in today, there are about 5 lakh people who are having this depressive disorder.
Oh.
Such a huge magnitude. Then the problem is, like, who are these people who get into depression? What is depression disorder? Now, like, every one of us feels sad.
Yeah.
Sadness is a normal emotion. And something happens, I fail in the exam, I lose something in the business, some death in the family, I feel sad. But every sadness, I am not calling it as a depression. But when it comes to depressive disorder, what people have to understand is, like, it is like any other medical disorder.
Oh.
We have typhoid,
Right.
we have diabetes, we have high BP. It is something like this. Maybe like,
There
it
is
may
some
not be.
medications.
Yes, it may not be so simple and then straightforward. I'm trying to make it as simple as possible. Then one of the common things people ask is, how can you say this is not normal sadness? And generally people say that, okay, right, you people psychiatrists make every sadness as a depressive disorder and you want to give medicines, you want to treat. It's not like that, it's not like that. There are definite criteria to say that sadness is not like in depressive disorder. Sadness is a normal emotion. It lasts for a few minutes, or a few hours, or a day or two, then it goes.
There is a time frame for it.
Depression. Usually there is some reason for feeling sadness. Something happened, I lost something, my boss fired, or some problem in the family, children family, or financially. Depressive disorder, lots of times, I think you have told very perfectly, this girl is doing fashion technology.
Yeah.
She doesn't have any problem, but she's almost on the negative side, negative spin.
Right.
Without context. Depressive disorder is defined as sadness and consistent, persistent sad mood for a long time without any context, without any reason. Then the question is, how does it happen? Why should people get depressed? It's because of brain neurochemical disturbances in the brain.
Oh.
That's because of that it gets happen. The reason why sometimes we talk and then go and talk again and again is, it's a simple problem. It's easily treatable. I think just about 3 years back, WHO has declared depression is a crisis all over the world. And the next slogan is, let us talk. At least let us talk about depression, then you go for the treatment. People don't even talk. I think you must have seen, it's just about 3 years back, 2-3 years back. For the first time, a celebrity talked about depression. Deepika Padukone came out and talked in front of cameras like this, saying that I did suffer from depression, I had gone for treatment for this, and then now I'm completely alright, I'm doing well. It's like, that's what I keep telling, that every psychiatrist and every professional in the field of psychiatry must really thank Deepika Padukone, because she has given us such a huge kind of an awareness to this problem. So the first thing is, we'll talk about it. Only when you talk, then the next step is this. So possibly, I don't say that there is definitely, possibly this girl, Sujata, may be having something related to depression. If it is that, better thing is, first you go and see a physician. I don't say that everybody should go and see a psychiatrist. See a physician.
How to bring her here?
Yeah, that's a big problem. I don't say it's a big problem now. It used to be a huge problem. As I told them, the moment you say you need to go to a psychiatrist, there will be now like a big commotion in the family also. No, we don't want to go. No, what's going to be?
Yes.
I understand to a certain extent because there is lack of awareness. People used to equate everything. The point is, when I go to a doctor for some problem, consultation, I go for a common cold, I go for a cough, I go for a simple viral fever, I go for TB, I go for cancer also. So every time I go to a doctor doesn't mean that I go for a treatment of cancer, I have a serious problem or tuberculosis. The same thing when somebody goes to a psychiatrist. A lot of times it can be a simple problem like tomorrow I have an exam and then I am worried, doctor. Tomorrow I have to talk in front of a group like this, doctor, and then I am feeling a little bit of social anxiety. It can be such a simple problem, but it can be one of the major illnesses like schizophrenia. We equate everything, we lump together and then produce the whole thing is a mental illness, which is a problem. The first thing people should know, I always tell that the best way you counter the stigma is we provide correct, proper treatment and get them out of it. You treat the patient who has come to you, complete, clean, completely, everything is alright. This patient will go and canvas. She may not say that I went for treatment, she will say her relative, there's some treatment for this, why don't you go? That's the best way. And then definitely, people have to talk about it, discuss about it openly, reasonably. Western community talks about it, but even in India, I'm telling you, compared to what it was, let's say about 20-30 years back, there's a huge change. People do come. One of the reasons for change also, the medication what we used to give 30 years back, they were giving a lot of side effects. But now it's much better. Suppose you didn't ask me that, shall I say that? Suppose you ask me, suppose I send it to you, patient with depression. Can you treat? Yes. Will she become alright? Yes. How much time, doctor? Maybe about 2 months. How much cost? Maybe about 500 rupees, 1,000. I may take 1,000 rupees consultation, it's a different thing, but we have very cheap medicines in India. It costs not more than 500 to 1,000. 500 rupees a month. I can treat depression in a period of 2 months. But this message has to go to the public. That's the most important thing.
Do parents also need some counseling in handling her?
Right.
at home.
I think you're slowly getting me to the right points of it, and then slowly we are getting a chain up to that. I think at this point, I think I may have to go a little bit more elaborate and talk a little bit more on depression before we talk about parental support and then counseling. See, I was talking about depression. There are a few things about it. Still, a lot of people think that it's simple sadness. No. There are 10 different types of depression.
Oh.
Psychotic depression, unipolar depression, bipolar depression, recurrent depressive disorder, postpartum, after delivery, lots of women develop depression.
Yes.
So there are so many different types of depressions out there. Each there can be a slight difference in that. So depression is not simple, not just sadness.
Doctor, I have an interesting person. Uh, his name is Shyam Kiran. He came from USA. He's doing his software job. He left it. He is 29 years old and he is obsessed with alcohol. Together, he is so abusive when he drink and smoke. On any subject, normally he is fine. He is my settlement. We play well and physically very well built. But when it comes to personal abuse, he is more abusive. He always praises himself sometimes of his profession and he thinks he is knowledgeable. If we try to tell something, he is always aggressive. He shows his aggression and never respects his parents, especially when he is in aggression. Normal behavior is different. And when he is with alcohol and smoke, and we think that is when he is in smoking and when he is drinking, he is more doing these abuses. But I feel it's not correct. He is having some problem. He is very aggressive. Suddenly he changes his colors and he becomes very angry. And we thought that it is of BP. He is taking some BP medicines also. But some abnormal behavior we have noticed is whenever he is angry, you don't know what he is talking with his friends and relatives. And sometimes he even breaks whatever he has got in his hand.
Okay.
And the smoking, we thought that smoking, we asked him to stop smoking and take more valuable food, vegetarian and all that. But he won't listen. He always thinks that he knows more. He knows more and he need not be taught by any other person. But in all other aspects, he is very natural person. He is diagnosed with BP, high BP.
Okay.
Yeah. What to do with him?
Yeah, this will be kind of, see, like what you were telling, that this person is young,
Yes.
very well qualified, and then he's doing a software job. Only thing is emotional outbursts, which is common, and then smoking, which is common. So the smoking can be, we can explain it in different ways. You may be having the smoking habit for a long time. What happens is that when we are emotionally a little bit of disturbed, we tend to abuse more. Whether it is smoking or alcohol, we do it more. This outburst possibly could be a personality. I cannot say anything more than that because that's his way of dealing with things, and then that is where, and he thinks he is right. Whatever I do is right, and then that is where it can be like that. So these kind of people generally don't go for a treatment because they don't have any depressive feeling, they don't have any other abnormality, they don't want to go. But the thing is, sometimes the simple counseling can help you. Maybe exactly may not be relevant in this particular situation, but now when you are asking about this emotional outbursts and that smoking and all things, what I remember is that of late what we have been seeing more and more frequent, not in this age group, but in the youngsters. Generally, which like 15 to 25 years age group, Almost every day I see at least 2-3 patients. Parents bring them saying that.
Okay.
One is drug abuse. Alcohol use has become fairly common.
He takes alcohol
Cannabis
too.
has become, yeah, that's right. Cannabis, weed has become fairly common. Lot of times the problem is that aggressive outbursts, breaking things. Verbally very violent. Physical violence is throwing things and breaking things.
Abuse.
Rarely become physically. Here some of the things what we have noticed is that personality disorder. What we especially call it, whether you call it a borderline personality, where people have unstable relations, they are emotionally very unstable. And then another very sad thing which I have noticed, this is of late is, especially youngsters. See, I have been practicing for the last 3 decades. First 2 decades, I don't remember seeing even once a year one case also. But now we see that almost every day I see a youngster with kind of cuts, wrist cuts.
Self-injury.
Self-injuries. This has become a very common thing. It's very difficult to explain how it is happening, where these people are getting the modeling. Any kind of an outburst, any kind of a disagreement, any kind of an exchange between parents. Parents say no something, they'll do that. Parents say don't do this, it's fine. Now is it because there's so much of a parental influence, too much has come there, like parents are trying to control everything. One of the things which a lot of parents come and tell me that, doctor, can you tell my child not to use mobile? It's become it's all over, WhatsApp and then social media.
Here we observe 3 things. One is he is not a social smoker. And behavior also there is abnormality.
Some depressive element also you see.
Yeah.
Then again there's an important link comes here. Especially in a little bit early age. When somebody is depressed, in the mood disorder what we call it as, all the addictions go up. Alcohol gives you some kind of a relief. See, when somebody is depressed, he's feeling sad, he's feeling dull, he doesn't feel like doing anything. And then most of the time depression, the symptoms are, I don't feel good. I feel very negative. I feel like crying. I feel sad. I don't have interest in watching TV. I don't want to read newspaper. I don't want to talk to you. I don't want to go out. No movies, nothing. I want to be alone myself. But at the same time, when I go and then sit alone, I don't feel good. Alcohol, a lot of times they use it as a self-medication. In this kind of a negative mood, then a friend will come and say, come, we'll go and have 2 drinks. Alcohol is it gives a slightly kind of a hyper, that elated mood. So they use it as self-medication, later they become addicts. Drug abuse, especially alcohol, cannabis, has become a very common thing, especially in people with mood disorders. This has become very common. A lot of times they don't come and tell me that I am depressed. Parents bring them saying that he is addicted to this, he is abusing this, he is taking this. So sometimes we have to be careful in that.
Which starts first, we can't understand which is triggering what?
That's
Smoking is triggering alcohol, or when he is taking alcohol, he is taking smoke.
And then again depression, which is first?
Which is?
Is he depressed first and that is why he is taking alcohol as a self-medication? Or he has been drinking regularly over a period of time, then he gets into the depression. It's not just a general question, but it becomes a very important question, even for me in the medical point of view.